This is News at Prime. Let's get you now another update on an important conference that's taking place, the 12th South African AIDS conference that's taking place at Emperor's Palace, and it has gathered as, should we say, a diverse assembly of leaders under the theme Unite for Change and Empower Communities, including redefining the priorities for HIV/AIDS. Let's get more into what has come out of that conference thus far. Zola Sholwana covering that story for us. Zola, good evening to you. The Deputy President who chairs SANEC, the South African National AIDS Council, speaking there at the opening of the conference. Did he give any clues about where we're going next in the fight against HIV and AIDS?
Well, the highlights from what the Deputy President said, Xoli, essentially was the fact that South Africa carries the highest burden when it comes to HIV and AIDS, acknowledging that as much as there's a lot to do, there is significant progress that is seen, especially considering the fact that there are preventative methods that were recently introduced in the past years, such as PrEP. Now, there are people that have access, to PrEP, meaning that prevention is better than cure. But we also heard frustration from civil society organizations that are working very closely with people that are living with HIV and AIDS to essentially say that government is not doing enough, because there are those that are vulnerable, that are not catered for in all the plans that were presented here today. But of course, this was just the opening. Further conversations will be held from tomorrow, as we understand that there are experts and also, researchers that will be, pouring in their information so that there is a way forward. Let me actually get to speak to, Sibongile Chabalala from Tech, who is going to be just giving us a reaction on what was said by the Deputy President. But before we actually get a reaction, Ma, thank you very much for your time. We saw your frustration when you're on stage, essentially saying that government is not doing enough to support people living with HIV and AIDS.
Yes, thank you very much for having me. We are really frustrated because as much as there's much progress that has been happening in South Africa, and we appreciate that as people living with HIV, however, there are a lot of gaps that needs to be addressed, and we are seeing government coming in a very slow pace, and at some point they also deny that there are these challenges on the ground. Like, for instance, the issue of preventative methods. Yes, there is PrEP, but there is a lot of stigma around oral PrEP. There is LEN that we know that our government has agreed to say Global Fund must support us to get lenacapavir. But then lenacapavir, it's one of the game changers. It's one of the preventative methods that will change people's lives. However, we are worried that we are still relying on the external donor on accessing lenacapavir, which means with the Global Fund cycle, we know that we only have 2.5 years to have LEN, and it would only cater for more than only 480,000 people, and we know the number, our population, we are above 60 million, and we know that out of that 60 million, only 8 million of people who are living with HIV or who are HIV. So the other number of people who will be in the first on the queue, who will be unfortunate not to access lenacapavir, who will be unfortunate not to have a choice of preventative methods. We know that all these things that we're talking about are accessible mostly in the urban areas, but in the rural areas, we don't see much of these implementation and programs that are going there. They are only going there on the World AIDS Days, World TB Days, but on the general day, it seems like there is nothing happening. Like, for instance, now we hear the Deputy President talking about that they are willing to work with us, but we have seen a pushback since the PEPFAR funding cuts, where the minister was denying that there are challenges on the ground. It's only now that they are agreeing to say, yes, there are challenges. He even went far as calling us names which we don't relate with those names, and he was pushing back while we were telling our frustration, because we could see that there is a problem. As you said, prevention is better than cure. When we see a crisis, we need to deal with it earlier so that we don't lose our gains. So we need a very responsive government. We need the government, especially the Deputy President, to stick to his words. And we need his voice. Hence, I kept on saying, Deputy President, we need your voice. We need you as a leader to push other leaders. We need him to use his executive powers to make sure that the HIV implementation programs are implemented correctly on the ground, not just as programs that are there for everyone to notice.
Mm-hmm. Of course, this is not the first time that this conference is held. Looking at the years that it's been held, as we understand that this is the 12th edition, what has it managed to achieve?
Honestly, it has managed to achieve a lot for us as communities, because we were able to get new research outcomes. We were able to have some space with our government to speak, because this is the most only time where you are able to tell the government how you feel. During the time, you always try to organize meetings and try to reach out to them, but you find that they don't come to party. So this is the only space where we can be able to push as activists also to say this is our demands, and it gives us that voice as communities. However, yes, as a country, we need to acknowledge that there are a lot of successes that came out of these conferences, where from 2000, the first conference, and today we have more than 6 million people on treatment. We know that we are still having challenges, however, our lifespan, it has increased, and we are grateful for that. But we thought by this time we will not talk about the challenges of people being infected of HIV, people dying of HIV, and all these challenges that we have.
Thank you very much, Sibongile Chabalala, there from the Treatment Action campaign, essentially touching on a very important aspect, Xoli, accessibility, because we've heard about these preventative methods that were presented here. Now, the biggest question is that in the rural parts of South Africa, are people aware of, PrEP, oral PrEP, injectable PrEP? Are they aware that they can go to their nearest clinics? And if they go to those nearest clinics, do they have, those injections? Do they have that medication? So those are, conversations that will be held tomorrow and elaborated on. We also heard the Deputy President acknowledging the fact that they know that as SANEC, that, the withdrawal of funding from USAID has impacted, civil society organizations and also HIV, people that are living with HIV and AIDS, but they are constantly finding ways now to make sure that they prevail and that the impact is not really reflected on the ground, or people do not really feel the pinch of the withdrawal of funding. So tomorrow will be another day. More speakers are expected to, engage. There's a lot of conversation that will be held, but the most important thing really is to come up with solutions, sustainable solutions in preventing HIV, so that South Africa does not become, in the next 5 years possibly, does not get to be known as that country that carries the heavy burden of HIV and AIDS globally.
Very important conversations at that conference. Zola Sholwana, thank you very much tonight for that update.